to my house and play house after this.
I don't know if I really feel that good though. I kind of just want to go home and watch TV.
Just stop it. There's ice cream at my house. You'll feel better eating ice cream.
You're trying to bribe me.
Yes. Okay, it's working a little bit. Oh. Being a baby.
But they feel funny.
Oh, stop it. I can't breathe that much.
Are you okay?
Oh, and I have a headache. Your eyes look really yellow.
My hands kind of hurt. And my feet.
Oh, are you okay? Can you breathe?
Not very good.
Maybe I'll call for help.
Yeah, you should do that. Hello. Hi, Callie. My name is Alyssa, and I'm going to be your nurse today. Can you just verify your name and date of birth for me?
Callie Schmidt. My birthday is January 15th, 2007.
Okay, so just tell me a little bit about why you came in today and how you're feeling.
Well, I was playing soccer with my friend, and then I couldn't breathe very well. My chest started to hurt, and she said I turned yellow.
Yellow? Okay.
So I sat on the ground, and then my hands and feet started to puff up.
Okay, so it just started when you started to play the sport?
Mm-hmm.
Okay.
Well, like 15 minutes after we got there.
Okay. All right, so I was able to take your vitals, and we have some oxygen on you right now because your pulse ox is low. So the oxygen is going to help you breathe easier and get your oxygen back up to normal levels. So I'm just going to go talk to the doctor with the labs that we took and the vitals, and I'm going to try and see what's going on with you today, okay?
Okay.
Oh, I think your mom actually just texted me, so she must have just gotten here. I'll go get her, okay?
Okay.
Hi, Dr. Levine. I'm caring for a patient who is a 5-year-old girl presenting with hypoxia, tachycardia, swollen extremities while she was playing soccer with a friend. Her history is unknown because her mother is unreachable and she's out of town right now, but she was brought in by a friend and the friend's mother. Her lab values include a decreased H&H, increased leukocytes, with a majority of them being neutrophils, and the platelet count is also decreased. The patient appears to be restless and short of breath. It had warm, swollen, and painful hands and feet. And then also jaundice was noted in the conjunctiva of her eyes. She does rate her pain at a scale of 8 out of 10, and she has been administered oxygen at 2 liters to help with her hypoxia. I think this patient would benefit from use of pain medications, as the pain is an 8 out of 10, and also I'd like to ask if there's any tests you want me to run.
I'll order morphine for the pain, and I would like you to run a peripheral blood smear, please.
Okay, sounds good.
Thank you.
Hi, Mom.
Hi, sweetie. How are you doing? I'm sorry I wasn't there.
That's okay. I'm better now. They put oxygen on me so I can breathe better, and they gave me some medicine for my pain.
Oh, okay, good. I'm glad that they gave you some pain medicine.
Yeah, my hands don't hurt as much anymore, so
Oh,
that's
good. Perfect. All right, then I'll just sit down and be with you, okay?
good. Okay.
Hi, Callie.
Hi.
How are you feeling now?
I'm feeling better.
Okay, because I know your pain was an 8 out of 10 before, and after we gave you the morphine, how are you feeling?
I'm not in that much pain anymore.
No? So on a scale of 0 to 10, 0 being none and 10 being the worst pain, how would you rate your pain?
I would probably rate it like a 3.
3? Okay, good. I'm going to go get the doctor now, okay?
Okay, thank you.
Hi, Callie. I'm Dr. Levine.
Hi.
You must be Callie's mom?
I am.
Okay.
Nice to meet you.
So we did a peripheral blood smear, and the results came back that there was an increased level of hemoglobin S on the erythrocytes, which is indicative of anemia.
Oh yeah, she was screened for that at infancy, and it did come back positive. And but this is like her first exacerbation with it. And when she was born, they told us that it was because of an increased levels of hemoglobin S, and that her red blood cells are shaped differently. Is that right?
Yes, that's correct. The nurse will be in soon to give handouts and provide more teaching regarding anemia to prevent further exacerbation. Do you guys have any more questions for me?
I don't think so. That would be very helpful.
Okay, the nurse will be in shortly.
Thank you.
Hi, Callie. You must be Callie's mom.
Yes, sorry, I was out of town, so I just got here.
Okay, well, I'm glad to see you here. So, the doctor came in and talked to you about what's going on and with your exacerbation?
Yes.
Okay, and you know about this already?
Yeah.
Okay, so I just wanted to make sure you knew because since you were out of town, your friend's mother didn't really know much about it. So.
Right.
Okay, so based on the clinical findings, I have developed a nursing diagnosis of ineffective peripheral tissue perfusion related to compromised blood flow secondary to, as evidenced by hypoxia, pain, and swollen extremities. To help with the symptoms of this exacerbation, my interventions will be to apply a warm, moist compress to the hands and feet once they are swollen and painful, and to also increase daily fluid consumption. And also I will provide teaching to prevent future exacerbations. So has there been any recent increase in physical activity?
She did recently start playing soccer in the spring, and that's where this happened. She was at practice with a friend.
Okay, that makes sense. Okay, so then dehydration and activities that increase oxygen demand can lead to these exacerbations, like the increased physical activity. It is important for your daughter to maintain adequate hydration and rest frequently when feelings of shortness of breath begin. Another trigger of exacerbations is being in a cold environment because it causes vasoconstriction and it decreases oxygen perfusion to the body cell. So it is important to dress warm when you're playing in cold weather. Okay. And here are some pamphlets that you can take with you.
Thank you.
To reference signs and symptoms of an acute crisis to let your primary caregiver know if this exacerbation occurs again.
Okay.
So do you have any other questions?
No, not right now. Thank you, though.
Okay. All right, Callie. Have a good day.
Thank you, you too.